Hello ladies and gentlemen, this is Robbie and welcome to a workout Wednesday and a manual Monday combined into one. Today we're going to be talking about a neurodegenerative condition called Parkinson's. A lot of people are familiar with it. It's a combination of symptoms that usually comes on later in life. And the biggest issues with Parkinson is the fact that it really limits people's safety and puts them at risk for falling, and typically that fear confines them to a sedentary lifestyle, which compounds other health issues. So Parkinson's is a very serious issue that we treat here in the clinic, and the way we do it is with a very manual, close, interactive approach, but it combines the hands-on treatment with therapeutic activities, and it's very engaging, and it's trying to stimulate the senses and to help to enhance the nervous system. So I really hope you guys enjoy this.
Hey everybody, this is Jonathan over at NeoLife for another Manual Monday. Today's topic is Parkinson's, and what I have here, I have my assistant Rachel. She's going to demonstrate what we're doing. And what this exercise is intended to do is, a lot of times when it comes to Parkinson's, the motor component of that disease will be that you lose that reciprocal and fluid movement, such as arm swings, opposite arm, opposite leg. So what I'm doing here is I'm just assisting with continuing with that motion. And you see she also gets a little bit of trunk rotation in there with it. And a progression for this exercise would be if she starts walking, so if she's right here and then she does run with left leg forward and then fly out. So she gets some assistance from me in maintaining that nice reciprocal arm movement, and not only the extent of her arm movement.
Here Zach is performing boxing exercises. Boxing has been shown by evidence and research to highly improve people's Parkinson's symptoms because it encourages a lot of movements that get affected by Parkinson's, more specifically trunk rotation and movement that crosses the midline of the body. And when you say the midline, you mean the middle of the body looking forward. You notice here Zach's doing broad sweeping motions, big weight shifts from one foot to the other, and then he's switching stances and performing the same thing on the non-dominant side. This is all working the nervous system and the brain. Here we have Carrie performing big exercises. LSVT is the abbreviation for these form of exercises, which is a bunch of what it stands for, big movements. And what you're trying to do is encourage big weight shifting, big rotations, functional movements as well. Like you can imagine her now reaching down to tie her shoe. This exercise protocol has been proven to really help people's Parkinson's symptoms and improve their mobility dramatically. Well, there you have it. I hope you guys enjoyed this video. Now I want you to consider, when you're dealing with Parkinson's, it's a disorder of the nervous system and the deep brain, the basal ganglia, which is involved with really pre-programmed big broad movement patterns such as walking, counter rotation of the body, and some of the most important functional movements. So these exercise interventions and the progressions that we're going to continue to show you today and on Wednesday are all geared towards improving the core underlying symptoms and the pathology related to Parkinson's disease. I really hope you guys enjoyed, and tune in on Wednesday for our follow-up video on Parkinson's disease, where we will talk about more in-depth interventions to treat Parkinson's disease. Thank you very much.